Oh, so the key takeaway is that philanthropy in India is both thriving, but has an opportunity to do even more extraordinary work going forward. And I've been very excited to come and be part of the launch of this new Sangnam collaborative that we're doing with the Perumal Foundation and a number of other partners. That's going to be working across 5 states and try to aspire to help support 70 million people across India. And really it's about how you bring the best of the private sector of philanthropy that can take risks and provide support for innovation in areas like healthcare or education, and then ultimately working with and through the direction of the government, which is providing huge leadership and strong resources, and ultimately build towards the vision of Viksit Bharat and 2047 that the government has set a very ambitious set of goals for.
So how much funds Gate Foundation is providing in this project?
So in this project that we'll be providing, the collective project we hope over time will become ultimately a $500 million project. At the moment it's going to be around $350 million in additional commitments, of which we, along with several other partners, are providing significant resources. But it's really less about the numbers of the resources that we're putting in, and it's more the sort of substance of the specific interventions that we're looking at in the areas like healthcare or education or nutrition or agricultural development support in states like Assam and Chhattisgarh and Jharkhand, where we're going to be working together.
So apart from this project, are you trying to collaborate with other people in some other project?
Well, we do already. So we have a wide range of philanthropic partnerships in India. We work with the Central Scare Foundation in education. We work with Nanda Nilekani in lots of areas of inclusive financial services and education. We've worked with a number of other foundations, the Reliance Foundation we do some work with. So really there's a strong and growing and very dynamic philanthropic ecosystem in India. I'm going to be part of a little later on my visit, speaking and working with a number of other philanthropists to do that. But it really is all about how philanthropy can actively support government. I talked a little bit on the panel about how the key is, in the end, that philanthropic resources are there to be a catalyst, that the real driving force towards social progress is always going to be government. If you're setting a vision for how you're going to get support and impact at scale. I talked earlier with the Health Secretary and the Health Minister about the work we're doing together on tuberculosis, where India is making incredibly rapid progress in both improving diagnostics and actually creating new low-cost diagnostics for tuberculosis, which are going to be important not just for India but for around the world, working together in vaccine prevention, working together in terms of treatment in areas like nutrition. And that's a disease that still affects millions of people around the world, not just in India.
All right. So what's your vision for next 5 years given for India?
Well, we have a vision for the next 20 years in India, not just the next 5 years. We've been in India over 20 years. We're going to be in India till we actually end as a foundation in 2045. The Gates Foundation will close its doors because we're hoping we'll have made such significant progress in the critical areas, especially of helping reduce maternal and child mortality and in addressing the big infectious diseases like tuberculosis, like polio and malaria, that we will be part of a transformative vision that really will be a part of helping India achieve its own vision of Viksit Bharat by 2047.
How AI is helping you?
Well, that's a lot of what actually I'm going to be seeing and meeting with a lot of partners over the next few days, because India is one of the hotbeds of innovation in AI, whether it's AI innovations around diagnostics. Again, we have been developing low-cost sensors that you can help in hospitals that can actually help look at, say, pregnant mothers or do diagnoses around tuberculosis, or others at a very low cost using AI algorithms that give you the same accuracy as if you're in a very expensive hospital in the United States. That we're seeing new treatment algorithms that actually help community healthcare workers make better decisions about how to treat if a child comes in with a fever, and you understand what are the interventions that are needed. But even more exciting has been some of the work in agriculture, where we've been working both initially at the state level in states like Maharashtra, but now working with the Department of Agriculture about scaling up what's going to be a very dynamic new interactive app for smallholder farmers that speaks in local languages, that is able to give access to best-in-class weather forecasting, support for how they map their soil health and what to use about fertilizer and seeds, how to access governmental support and extension services and subsidies. This is an area where India again is leading the world, has already seen some very exciting models, and we hope to both achieve scale here in India with AI, but again take many of those models and help them work in countries across the continent of Africa, for example.
So last question, what are the challenges prevailing in this sector, and second, what kind of support you are looking from the government of India?
Well, the challenges are always, first of all, we have so many people we want to reach. We need to drive down the costs as much as possible to make this affordable. And that's where I gave an example that working with an Indian partner, we've recently been able to bring the cost of a diagnostic test, how to test whether someone has tuberculosis, to less than $2 a test. This is historically, the cost has been 10 times as much as that. We're trying to do the same when it comes to treatment, when it comes to the sort of cost and accessibility of vaccines, when it comes to the cost and accessibility of availability to seeds or livestock in the agricultural sector. Another sector we're working on is education. Can you get sort of low-cost tools, AI-enabled curriculum support for teachers and students that bring down? So that's one of the big bottlenecks, but it has to be cost with quality. That are you really getting the results? And that's again where an institution like the Gates Foundation can help develop. We'll do some of the pilots that do the heavy testing. Does this work? Does you actually achieve the impact you want? And then by the time we're partnering with the government, we're able to say, here's the proof that they can look at of how these interventions actually work and how they can scale that. And what you need is this very dynamic shift working between the philanthropic system, some of the private sector partners that we've helped develop the products with, and then ultimately support from the government. And I'm very pleased to say that this has been one of the most exciting things with this government. We have an extremely receptive and supportive ecosystem coming from the Honourable Prime Minister down in terms of the commitment in the sectors we work on, in agriculture and healthcare and education. India is a true global leader right now, and that's why it's so exciting to be part of this work.
If you like this video, then like, share and subscribe to Mirror Now.